It is indeed our pleasure to welcome you both to the Zambia's 8th Health Research Conference and the 12th HIV Technical Conference in Lusaka. We are expecting a record number of participants. We had originally estimated that we will have between 800 and 1,000 delegates. By our numbers yesterday, it looks like we might have somewhere close to 1,200 delegates. I know that they are still coming in, so the numbers may look a bit low, but we are expecting between 1,000 and 1,200 delegates. We are definitely thrilled to see that our research community, both international and local, are becoming larger and robust. As you have all noted, the theme of this year's Health Research Conference is breaking new ground in health research, moving from results to implementation without leaving anyone behind. The theme also is in conjunction with the 12th Annual HIV Technical Conference, whose theme is sustaining the momentum towards HIV epidemic control. And this recognizes Zambia's progress in the field of health research, but also acknowledges that there is need to translate all the research outputs into action. Now, when you look at the conference theme, there's a component at the end that says without leaving anyone behind. And you see there the focus is inclusivity. To be inclusive, we are committed this year and for the future conferences to include participation from health personnel at all levels, from the non-scientific community, so that they appreciate the value of research to them as individuals and to the country's development in general. We actually want to demystify the whole concept of research. That research is not just for the elite, it's not just for the scientific community, it's basically for everyone. We are honored to have partnered with many organizations and researchers this year to bring a program that incorporates a wide range of topics, including novel and cutting-edge research. The program includes keynote addresses, and one of them will be in this session. We have oral presentations in the plenary and parallel sessions that Dr. Mlenga was just alluding to. We will have poster sessions. Your program says we will have panel discussions. Originally, we were going to have panel discussions, but some of those will happen in the symposia. We also therefore have scientific symposia. As you would have seen if you have walked around, there will also be exhibition centers for participants to learn more about what our partners are doing. We will also be presenting a number of awards during tomorrow's program. And we do trust that you will find the program informative and interesting. We urge you to use this forum to learn, to grow, to connect with other researchers from across Zambia and beyond. And because of that piece of connection, we have a networking event that we have organized for tomorrow. Unfortunately, we will not have everybody in there, but there are people that have been invited to that networking event. So we hope you will take advantage of that. Before I end my opening remarks, I need to appreciate our sponsors. And when you look in your program, at the end of the program, you have a list of all our supporters, our sponsors. We would not have achieved this without them. I think that it's very, very important that we recognize them. So I am actually deliberately going to read each of our sponsors because we need to recognize them. PEPFAR, and obviously the Ministry of Health at the core of everything. We have the University Teaching Hospital, EQUIP, the Michael Research Trust, Milan, PATH, and under PATH there's also Masepa there, ZAMRA, or Zambia Medicine Regulatory Authority. We have the School of Medicine, we have the University of Maryland, Clinton Health Access Initiative, Center for Infectious Disease Research, CIDAS, USA, at the core of course, PEPFAR, Zambia National Public Health Institute, FHI 360, Bloomberg Data to Policy Initiative, and there's a special session on policy today, which is sponsored by the Bloomberg Data for Health Initiative, National AIDS Council, Abbott, CDC, UNICEF, Health Resources and Services Administration, ICAP, Frontier Market Solutions. We have BD, Gilead, Hologic, PPZL, Champion, Jepaigo, and the USAID Rapid TB project, which is of course under PATH. So if for some reason I've left out any sponsors, you forgive me, but the program has all our sponsors. And lastly, I hope that all of you will be able to have or has been able to get the program. But you know, we want to go green, and there is an app. How many of you have been able to download the app? Hands up. I see few. So it's very, very helpful because the program is on the app and the schedule for each day, the schedule for each day is on the app. You are able to follow what the schedule is for each day. Also, the abstract book is also on the app. So it's very helpful. Essentially, you can just move with your phone and everything is loaded there. So you go to our website, the National Health Research Authority website, www.nhra.org/Health Research Conference App. I think that's what it's called. Conference app. So /conference app. So thank you so much.
So those are my mentors and my colleagues. So as we all know that hepatitis B remains a major public health concern worldwide, with over 257 million people infected, and sub-Saharan Africa bears the substantial burden with a prevalence of 6.1%. With this prevalence of 6.1%, we know that there are variations from country to country and region to region. And over 887,000 deaths have resulted as a result of hepatitis B. In Zambia, our overall prevalence stands at 3.5%, that is in the ages 0 to 59 years old, which translates to approximately 896,000 Zambians infected with hepatitis B. The prevalence among pregnant women stands at 6.5%, and hepatitis B remains a major cause of cirrhosis and also contributes to about 50% of cases of liver cancer. Hepatitis B is further responsible for most of the mortality in persons with liver diseases, and the overall risk among adults, the overall risk for chronicity among adults is about 5%, but the risk for chronic infection is higher in infections which are acquired at birth. Most of the people who are infected, usually they may be without symptoms and they may not know that they have hepatitis B. This graphical presentation just shows what I was explaining, that 90% of the infections acquired at birth end up in chronic infection. So mother-to-child transmission accounts for about 1/3 of the global hepatitis B burden. So if a pregnant woman is positive for hepatitis B, we're talking about their newborn, 80 to 90% of those newborns becoming infected, and 90% of those developing hepatitis B, as I just explained from the previous graph.
Stand and sing of Zambia, proud and free, land of wake and joy in unity, victors in the struggle for their rights. We've won freedom's fight. Oh, one, strong and free.
The Honorable Minister of Health, Dr. Charles Rufia, the Permanent Secretary, Minister of Health Services, Dr. Jabin Mwanda, Permanent Secretary in charge of Administration, Dr. Kennedy Malama, Permanent Secretary in charge of Training, Professor Elwin Chomba, the U.S. Ambassador, Mr. Daniel Foot, National AIDS Coordinator, Mr. Fortune Chibamba, the UN AIDS representative, Dr. Kenneth Mwansa, PEPFAR coordinator, Ms. Bethany Baxter, the CDC country director, Mr. Simon Agori, the USAID Zambia Health team lead, Ms. Melanie Luke Martins, the WHO country representative, Dr. Masaninga Fred, the CHAI country director, Ms. Hilda Shankwelele, invited speaker, Dr. William Moss, and my chair, Professor Everest Jeresani. I would want to recognize all the health directors and members of the press and the organizing committee. I want to recognize the scientific chairs for the conference. That is Dr. Mkonka and Professor Chipeta. Ladies and gentlemen, welcome to the 8th Health Research Conference organized by the National Health Research Authority, a statutory body under the Ministry of Health in collaboration with the HIV team under the Ministry of Health. Let me start by thanking my parent ministry, the Ministry of Health, for the priority that it has placed on the development of health research system in Zambia, making it one of the key health systems for the achievement of its legacy goals. Research is critical to the achievement of Zambia's legacy goals because it provides us data and information not just on what interventions, medicines, technologies, laboratory tests work better, but also how those interventions that have been proven to work can be better delivered to achieve maximum health goals. Operations and implementation research provide policymakers and program implementers with information on how to better implement programs to improve health outcomes. Appreciating the importance of research, the government of the Republic of Zambia passed the National Health Research Act No. 2 of 2013, which created the National Health Research Authority. The authority started its full operations in October 2017, making it just 1 year and 2 weeks today. The authority's mandate is to regulate research, promote research, coordinate research, build research capacity, facilitate the translation of research results into policies and programs, with the ultimate aim of improving people's health status. Since its inception, the authority has gone flat out to improve the health research environment in Zambia. I'll just highlight some of achievements in the last 1 year. Number one, the development of the Health Research Authority Strategic Plan, which set the authority's vision, mission, and key strategic areas of focus. Number two, the development of the National Health Research Agenda, setting the National Health Research priorities that clearly align with the country's 7th National Development Plan and the Ministry of Health Strategic Plan, so that research done in this country addresses national health research gaps and needs. The main objective of the National Health Research Agenda and priorities is to align the production of research evidence to the National Health Research goals and objectives, as well as provide evidence, guidance to researchers, research institutions, academic institutions, policymakers, program implementers, health development partners, and other partners on Zambia's health research focus. Number three, development of guidelines for research in traditional, complementary, and alternative medicine that provides to promoters or guidance to promoters and researchers in traditional medicine so as to explore and discover the untapped potential in traditional medicine. Number four, digitalization of the research approval process so as to improve efficiencies in terms of time and money in the clearance of research protocols. Number five, standardization of the training of research assistants by developing a standard curriculum as a research quality assurance measure. Number six, but not the least, is the creation of a knowledge translation platform to facilitate translation of research results into policies and programs. One of the results of that research translation platform is this research conference that we are witnessing today. This research conference is intended to bring together scientists, policymakers, funders in industry, and the general public to share research findings and information on progress made to reshape the global health agenda. More importantly, the conference will create a forum for all research conducted in Zambia that has not yet been disseminated to be disseminated. And all policy-relevant research then, at the end of this conference, will be synthesized into policy briefs for translation into appropriate policies. The theme of this conference is breaking new ground in health research, moving from results to implementation without leaving anyone behind. The theme stresses the need to put research into practice and the need to demystify research by involving everyone. The second theme, since this is a joint meeting, the second theme is related to HIV and will be elaborated later on by Dr. Mlenga. But before I end my remarks, let me highlight some of the key features of this conference. Number one is the launch of key strategic documents that I have just highlighted by the Honorable Minister of Health. There is the awards ceremony that will recognize and honor research institutions, researchers, and others who have greatly contributed to the development of research and health in general, especially health promotion in Zambia. Number three, there will be a networking event providing an opportunity for invited delegates to network and explore areas of collaboration in research development. Number four is a policy forum that has already taken place. Number five, as you would have seen, there are exhibitions providing an opportunity for stakeholders to showcase their products and services. Lastly, let me thank all our cooperating partners for their support to this conference. Without your support, it would have been impossible to bring everyone together as we have done. Thank you so much.
We now have the first opening speech. Allow me to invite the UNAIDS representative. Shall we put our hands together for Dr. Kenneth Mwansa?
Good morning, ladies and gentlemen. The Honorable Minister of Health, Dr. Chilufya, Permanent Secretaries for Health Services, Administration and Training, the U.S. Ambassador, Mr. Daniel Fort, the PEPFAR Coordinator, Madam Bethany Baxter, the CDC Country Director, Dr. Simon Agoroli, colleagues from the UN family, the USAID Zambia team lead, Madam Melanie Louis Martins, dear co-chairs of this conference, moderators, colleagues and friends. Honorable Minister, the statement from UNAIDS simply states AIDS is not over in Zambia, but it can be. It is an honor and privilege to join you, Honorable Minister, and distinguished delegates, and be part of this important 8th Zambia Health Research and 12th Annual HIV Technical Conference. With over 1,000 registered participants, this is admittedly one of the biggest gatherings on AIDS in Zambia, bringing together government, scientists, civil society, activists, healthcare providers, and the private sector. We are partly here to talk about the needed transformation to ensure that Zambia controls the HIV epidemic, as the theme for this year has aptly put it, sustaining the momentum towards HIV epidemic control. UNAIDS launched the 90-90-90 to close the treatment gap. Today in Zambia, nearly 900,000 people are on treatment. However, about 300,000 people are still waiting to be put on treatment. we are particularly lagging behind in meeting the treatment targets for children and adolescents. We all want to see inclusive, just, and healthy Zambian societies. In order to reach epidemic control, we should double our efforts and ensure that no one is left behind. But in reality, our country is struggling with poverty, growing inequalities, and the inability to reach the most difficult populations. We should not lose our focus on ensuring that we reach every individual that requires help and those families that we are failing to reach and keep them healthy.
Guest of honor, the Honorable Minister Chilufya MP, permanent secretaries from the Ministry of Health, our colleagues who do wonderful work from the UN family, cooperating partners, our friends and professional health sector colleagues from the United States and from other countries, participants in this 8th Health Research Conference and the 12th Annual HIV Technical Conference. Here and remotely, I am looking at screens of people who are participating in our new ECHO program, which I'm going to talk to here remotely from other parts of Zambia, which is very exciting. I'm going to piggyback on the Director of Ceremonies a little bit after I say distinguished guests, members of the press, ladies and gentlemen, all protocols observed. The Director of Ceremonies and I have done a number of events together. He's a funny guy. And I was surprised when he said he's never been to the United States, and I will tell him, there you are, that if you continue to behave and don't overshadow my jokes, we may be able to get you a visa to the United States. Good morning. I'm delighted to be here today to witness the launch of the Clinical Mentorship Program and Project ECHO, which stands for Extension for Community Health Care Outcomes, a unique telementoring platform that connects remote clinical sites with central specialists. Unveiling Project ECHO at this 12th Annual HIV Technical Conference underscores the need to continuously innovate as we accelerate towards epidemic control. Zambia's most important resource, in my opinion, and in my government's opinion, is its people. And for that reason, the major focus of American intervention and support here in Zambia is in the health sector. Now, the minister told me today that I would be coming to address a small group of medical professionals, and I look around here and I see, oh my gosh, I usually don't get nervous when I talk, but I'm a little nervous today, particularly because the more I speak with medical professionals, the more I get used to being the dumbest guy in the room. But this is the biggest room I've been the dumbest guy in, so you make me a little overwhelmed today. The U.S. government, as most of you know, supports the implementation of HIV prevention and treatment programs to help Zambia arrive at epidemic control through our President's Emergency Plan for AIDS Relief, or PEPFAR. In 2004, less than 5,000 people in Zambia were on treatment when PEPFAR began. Today, 15 years later, we have invested $3.5 billion with a B of American taxpayer money, and we now have about 900,000 people on treatment. As Dr. Mwansa mentioned, Our targets are to get to 90 epidemic control. And while I sort of understand it, you guys understand it better than me, so I'm not going to go into the details here. Our science has shown us that the people who are on treatment with the virus fully suppressed, the final 90 of the 90, are able to live a normal life expectancy, especially if they are diagnosed and put on treatment early before their immune system is damaged by the virus. This is exceptionally exciting. One of the most exciting things I've seen here in Zambia is HIV-positive mothers who have given birth to HIV-negative babies. And what was considered 15 years ago to be a life sentence has now become, as Dr. Mwansa mentioned, a chronic and manageable disease. And to see these beautiful babies and their mothers that are so happy, I'm not really emotional or a guy who is terribly sensitive, but it almost brought a tear to my eyes. Despite all this progress, however, we can continue to have people who are left behind. We believe that 30% of the people in Zambia living with HIV are not aware of their status. That means they're not able to access the life-saving care and treatment, and they continue to unnecessarily get sick and in cases die from HIV. HIV patients continue to die unnecessarily in some cases, even while on treatment. And one of the main reasons for these deaths of patients on treatment is the lack of access to medical specialists, who are few in number and concentrated in the rural centers like Lusaka and Ndola. PEPFAR and the U.S. Centers for Disease Control and Prevention are working with the Ministry of Health to respond to this need. Today we're going to launch the clinical mentorship program, Project ECHO, which aims to improve the quality of services at all HIV facilities in Zambia. Project ECHO started back in one of our most rural states, New Mexico, as a way to meet local health care needs in a large, sparsely populated state with one large population center. Our pledge to support Project ECHO is part of the American government's larger commitment to strengthen Zambia's most important resource, its people, through its healthcare system, including healthcare providers. The U.S. government will contribute more than $2 million to cover the technological and human resource needs for clinical mentorship using ECHO out of our annual contribution to Zambia in the HIV/AIDS fight of approximately $400 million. In closing, I want to congratulate and thank my friend, the Minister, the PSs, and all our colleagues in the Ministry of Health for working together to establish Project ECHO in Zambia. It is because of all your great work, not only in the ministry, not only the Americans, not only the cooperating partners, but all partners in Zambia and from around the world, that we are making progress and we are witnessing this great achievement. Thank you very much.
Very important task at this research conference, and that is to recognize and honor some men and women who have exceptionally contributed to the development of health research and to health promotion in Zambia. First of all, my ministry has decided to recognize 3 prominent scientists who have since left us, and these are the late Honorable Dr. Joseph Kasonde, former Minister of Health. Dr. Joseph Kasonde is being honored for his contribution to the development of the health research system in Zambia, including his contribution to the enactment of the Health Research Act and the formulation of a knowledge translation institution called Zambia Forum for Health Research, ZAMFO. May he so rest in peace. Professor Chifumbe Chintu, for his contribution to his medical education, to medical education in the country and to health research, especially in the area of pediatric hematology and oncology and TB, HIV co-infection. May he so rest in peace. Professor Neil Kanza, the first Zambian pathologist, for his contribution to biomedical science in Zambia. One of Prof. Kanza's work still stands in the name of Kanza Laboratories, contributing greatly to diagnosis and subsequent management of various illnesses in Zambia.
This award goes to two institutions, and I'll read out the first institution. This institution is rurally placed. It's a rurally placed Zambian health research institution whose research work started in 1989-1990 from a hospital base, gone on to get registered as a research institution in 1994, and later becoming a state-of-the-art research institution with state-of-the-art research infrastructure. The institution is being recognized for its work in malaria research, malaria control in Zambia, contributing to Zambia's quest to eliminate malaria. The area around that research institute is one of the first areas in Zambia to see malaria incidence and prevalence reduced to almost zero. The institute is also being recognized for demonstrating that good quality and policy-relevant research can be undertaken in a very remote rural setting. This research institute is Macha Research Trust.
The institution runs a number of state-of-the-art laboratories and has conducted a lot of policy-relevant research over the years. The institution is also involved in some key vaccine studies, including the HIV vaccine trials in Zambia. And this award goes to Center for Infectious Disease Research in Zambia.
And the name is Biennial.
chairperson.
Investigating or undertake, at the end of the day, ask yourself, is it relevant? Is it going to contribute to improving service delivery in the context I've defined it for Zambia? Once again, enjoy yourself. I'm told the red wine is good for the cardiovascular system.
The main organizing team, Dr. Biennial and team, Dr. Murenga, again, congratulations for a very successful conference. I am told that the conference has seen a record number of participants, far above the original estimate of 1,000. I think we have on record 1,300 participants. That's so research is very important, and as far as the Ministry of Health is concerned, we see this as a very important aspect in our quest to attain universal health coverage. For that reason, we have embarked on a program to strengthen research, health research in particular. And we saw not long ago the creation of the National Research Authority, because in the past we had research that was not so well coordinated and sometimes not relevant to our situation. So some form of
And you can already see the value of our having a national research authority. Yes, research, but it's not just about evidence, generating evidence. Research is meant to solve problems. Research is meant to allow us to provide the health services that we need so we can have a healthy population. So this conference also demonstrated that there's more to it than just evidence. We saw some good practices. We saw evidence of how research has been translated or has transformed or changed the way we do business. The other theme for the other twin, sustaining momentum towards HIV epidemic control and living, did you say living no one behind? Of course, we have scored a number of successes in addressing the HIV epidemic, and we know that we can completely control the epidemic, but that will require that we sustain the momentum, we sustain the gains that we have so far recorded. And on top of this, we need to find clever ways to do that which we have failed to do over time. So these two conferences happening in the same room couldn't be a better idea. So in as far as our ministry is concerned, we will continue to ensure that the research that is done is relevant and that the results are translated into policy. So the research must be relevant to our problems. It must answer our problems. I hate to sound like a priest, but sometimes I believe in my next life I will be. I will stop, but before I stop, let me just say thank you to all of you for your participation. But also want to specifically thank those of you who put in or contributed materially, technically, financially to this conference. Very successful conference indeed. And if I mention you or your organization, please demonstrate to me that you are here by saying something. What you say, I don't know, but say something. So I would like to specifically thank the Ministry of Health. Of course, the UTH HIV program, PATH Masepa, USID Eradicate, Clinton Health Access Initiative, Abbott, BD Zambia, EQUIM, USID, Discover. Okay, I said say something, but you did something. That's acceptable. University of Maryland, Centers for Silence. Let me say silence, it's easy. Are you there? UNICEF, Mylan Pharmaceuticals, ICAR, the Bible, SSG, Access for All, FHI 360, HealthNet Services, Zamra, ZNPHI, Marcha Research Trust, Philips, Gilead, AbbVie, UNZA, School of Medicine, Movement Data for Health Initiative, Embryo Diagnostics. There could be many more I do not have mentioned, but I'll try my best. If I've omitted you, it's not intentional. It's because